Hello, and welcome to today's webinar, The Nexus of Sex Work and Homelessness. I am Melina Boyer, and I will be the moderator for the webinar presented by the National Healthcare for the Homeless Council as part of our spring virtual training series, Her Health, Her Housing, with support from the Health Resources and Services Administration and the Bureau of Primary Health Care. This is a 60-minute presentation with the last 10 minutes reserved for Q&A. There is a chat box below the presentation slides for participant questions and technical issues. Please type your questions or technical issues into the chat box at any time during the presentation. A select number of questions will be answered at the end of the presentation during the Q&A session. Remaining questions will be logged and provided to the presenter for written responses after the webinar. If you are having technical issues, you may also call Caroline Gumpenberger at 615-226-2292, extension 222 for assistance. This session is accredited for one continuing medical education credit hour through Vanderbilt University Medical Center. If you plan on claiming credit, please copy the information located in the CME Information Notes pod at the end of this session and follow the instructions. The claim code will only be available during the session and will appear in the last 20 minutes of the presentation. In order to receive credit, CMEs must be claimed within 3 days of the end of this presentation. I will also repeat that at the end as well. Our presenters today are Jonathan Santos Ramos, who is the Director of Community Engagement and Strategic Initiatives at Callan Lord Health Center, where he is responsible for internal and external relationships, building, maintenance, and Board of Director liaison, as well as working directly with the Executive Director, leading initiatives that are strategic for Callan Lord's continued growth. He received his Master's in Public Administration from the Executive Program at Barack. Secondly, we have Joanna Rivera, who is a South American transgender woman raised in a strict Jehovah's Witness household who personally experienced homelessness at a young age. While searching for safe places, Joanna began to volunteer at organizations like Housing Works and Audre Lorde Project. Through an outreach worker at Housing Works, she was invited to Washington Heights Corner Project's transgender support group, where she was very vocal about issues surrounding the limited educational resources for transgender individuals. In August 2015, Joanna was hired as an outreach worker working specifically with the transgender community and with sex workers. Additional duties included being the lead facilitator of the Uptown Trans Social at Washington Heights Corner Project and to lead workshops on safer sex and created a space for safe hormone injection. In February 2016, Joanna was hired as a youth counselor at the Forney Center, where she discovered a huge passion for working with young LGBT people navigating homelessness. Joanna began supervising the overnight for Forney Center's Transgender Housing program 3 months after joining the agency, and as of March 2017, is the Director of Transgender Housing. Her primary duty is to ensure high-quality care of the 18 youth residing in the Transgender Housing program. Third, we have Aruna Krishnakumar, who is the Director of the Health Outreach to Teens, HOTT, program at Callan Lord Community Health Center, which provides comprehensive health services to LGBT youth ages 13 to 24. She is a licensed social worker who received her training at Columbia University School of Social Work. Aruna previously worked at the Hetrick Martin Institute as a mental health clinician and supervisor, and has worked at numerous LGBT youth organizations and domestic violence agencies in North America, and currently sits on the advisory board of Project 10, an LGBTQ youth drop-in center in Montreal, Canada. She has been working with LGBT communities for over a decade, and her areas of interest include the intersection of race, poverty, and homelessness, and HIV/AIDS with LGBTQ youth. And lastly, we have joining us Tracy Brown, who is a coordinator of training and advocacy at the Forney Center. So at this point, I would like to hand the mic over to our presenters.
Thank you, Elena, and thank you all for participating in today's webinar. I'm Jonathan Santos-Ramos, Director of Community Engagement and Strategic Initiatives at Town Lord Community Health Center, and my pronouns are he and him. In planning of this webinar, we quickly noticed that the intersections of gender, homelessness, and sex work are vast. So many layers to dig through and many directions today's conversation can go in. Because of this and time constraints, we hope to lay some really basic groundwork about some of the connections, correlations, and causes between gender, gender representation, homelessness, and sex work. Today we will be concentrating on how feminine-presenting youth and adults are very present and visible in street sex work, but will give context outside of that realm whenever possible. We hope to start with the basics. Go here, sorry about that. We hope to start with the basics and give folks a brief overview of some of the issues facing feminine-presenting folks experiencing homelessness, as well as some challenges of how to serve these communities. We will then define some terms that will be used throughout today's discussion and why those definitions are important in the context of today's topic. We will then look at some national and local data separated by gender, as well as health disparities facing women in the shelter system in New York City. We hope to connect homelessness and sex work, and then take a deeper dive with my colleagues here on what we're seeing in New York City, specifically around feminine-presenting youth and how to customize programming and approaches for clients who are experiencing homelessness and disclose engagement in sex work. Although a large part of today's presentation is about youth, many of the tools can be used for many clients experiencing competing barriers to accessing healthcare and social services. We hope today's presentation and concepts will be the beginning of many conversations, and hopefully a catalyst to explore several of these layers in more depth in the near future. So the basics. First, we hope to get a general understanding of some of the many factors that contribute to cis women and LGBTQ plus folks finding themselves homeless, and each of them coming with specific challenges for healthcare and social service providers to effectively provide care services to these communities. Economic and employment, like the lack of access to employment and employment not providing living wage, this also impacts benefits and eligibility for public services programs. Some jobs will make you ineligible for programs due to income requirements, but those same jobs are not providing adequate pay to cover living expenses. Discrimination, many folks are dealing with multiple systems of oppression at the same time and are feeling the pangs of discrimination at every turn. Interpersonal violence, many who have been exposed to violence, both familial, intimate, or otherwise, may be experiencing traumas that are affecting the ability to cope with life's ins and outs. That leads to mental health, mental illness. Psychiatric disturbance is a much noted feature in the new urban homeless landscape nationally, even though there's a huge gap in available services, especially for those recently discharged and dumped into shelter systems with behavioral health programs for those with predispositions, slow decline, or sudden trauma. Health disparities, we know that social determinants of health, which are conditions where people live, learn, work, and play, affect a wide range of health risks, and this plays a major factor in comorbidities. Substance use, this allows us to, this includes those using sex work to access a supply and those who are self-medicating, some of which are as a result of some of the same lacks of resources to deal with mental health and trauma. Familial rejection, and familial rejection includes many cis women experience familial rejection, including but not limited to birthing a child. It is said that the majority of street-involved women are mothers of minor children. Many LGBTQ plus folks face this rejection as youth, as my colleagues Tracy and Joanna will demonstrate shortly. Intersections of institutional oppression, racism, classism, sexism, homophobia, machismo, and we can go on and on. We especially see this among women veterans experiencing homelessness with roots in pre-military adversity, post-military interpersonal violence, unemployment, and PTSD. And finally, lack of data. Data is many times incomplete and or underreported. This lack of data, including outdated information, may cause major gaps in accessing communities, especially parts of the community with emerging issues that may not be identified due to not having data in real time. So some definitions, and there's actually a couple missing here that I'll mention in a second. So sex work is any type of labor when the explicit goal is to produce a sexual or an erotic response in the client in exchange for materials like money, food, housing, goods, or emotional gain. The sex work landscape looks different in different places, and many sex workers and their challenges can be differentiated by race, class, gender, nationality, citizenship, etc. The social hierarchies within the sex work economy then play out in different ways. Although we will be talking about serving mostly street sex workers, we would be remiss not to mention how the sex work industry and its definition has grown with the diversified use of websites, social media platforms, and apps. Technology has taken a front seat in what we previously defined as sex work. Feminine presenting is an individual's gender identity usually expressed through behavior, clothing, haircut, or voice that may be socially associated to feminine or non-masculine behaviors and characteristics. The reason why this distinction is important for us today is because the data is not always clear on whether the services are being provided to clients who are cis women or someone of trans experience. In addition, violence happens mostly as a result of perceived gender expression and not actual gender. Clients on the feminine spectrum many times report similar experiences around violence and control forced upon them. Under that umbrella, but not limited to, are cis women, individual whose gender identity matches the sex that they were assigned at birth. What you don't see on your screen also includes gender non-binary, an individual who does not identify as either male or female, and gender non-conforming, an individual who may act or present in a way contrary to societal expectations of their gender. Transgender is that individual who feels their sex assigned at birth is a false or incomplete description of themselves, noting that those under the trans umbrella may or may not identify as transgender. So published in 2018, Annual Homeless Assessment Report to Congress stated that 39.1% of folks experiencing homelessness were female, 0.5% were transgender, and 2% were gender nonconforming. Like most data on homelessness that always seems to be incomplete or underreported, as I mentioned, we do know that the TG&C, G&B numbers are most likely due to how data is recorded. For instance, someone not being educated on the difference and thus recording someone by perceived gender, and or the use of non-inclusive gender assessment tools. Not to mention the ways in which TG&B and G&C folks do not access systems due to fear of rejection, violence, or other factors that may result in them not being counted. Between 2017 and 2018, there have been several increases in the assessment of homelessness. 3% of women experience homelessness as individuals. Women in sheltered locations increased by 2%. Women as individuals in unsheltered locations increased by 4%, and transgender individuals increased by 22%. This information was published by the New York City Department of Homeless Services circa 2005, which is the last time a report of this nature was produced from the department. Here we see alarming health disparities in cis women in the shelter system. Death rates due to HIV/AIDS were 9 times higher among single adult women who use the shelter system than among the New York City adult population. And females were 11 times higher with TB rates among adults in single adult shelters. Really scary numbers. Homelessness and sex work. As mentioned in the intro, many of the challenges faced by folks experiencing homelessness and engaging in sex work can be differentiated by race, class, gender, nationality, and citizenship, to name a few. For instance, depending on citizenship and status, there is sometimes confusion between sex work and sex trafficking, which my colleague Aruna will try to separate a little later. This becomes especially problematic when women who have migrated without legal documentation by paying a coyote to make it safely across, as stated by Dr. Garriga Lopez, are being criminalized and thereby jailed or deported based on the assumption or actuality of sex work performed, either voluntary or under coercion. Many feminine presenting persons have had exposure to violence, rape, and or coercion that has resulted in engaging in sex work while experiencing homelessness. We keep on mentioning resources, and resources become a major factor in initiation into sex work. If someone does not have the resources to get into housing, access to food assistance, or simply access to safety, they are more likely to engage in survival sex, facilitating the entry into sex work. Gender power dynamics on the street include the development of intimate relationships for survival and makes clear connections between homelessness and sex work. I know that this is very brief, and as mentioned, any of these can be discussed on their own hour webinar, but in the interest of time, I will pass the presentation to my colleagues from the Forney Center, Tracy and Joanna.
Hey everyone, this is Tracy. My pronouns are they, them. So first I'm going to just tell you a little bit about the services at the Forney Center. So our mission is to protect LGBT plus youth from the harms of homelessness and empower them with the tools needed to live independently. So our population is LGBT youth ages 16 to 24 who are either experiencing homelessness or at risk for homelessness or are inconsistently housed. So as the scope of our services, basically we're like, I would say like a one-stop shop. So we have wraparound services that include case management, intensive case management, therapy, psych services. We have a medical provider that visits our drop-in center 3 times a week. So a young person can kind of like sign up for the med clinic and like be able to see a doctor and not really have to go outside to maybe check in with someone that maybe doesn't understand them as much. Our housing services include drop-in, emergency housing, transitional housing, and transgender housing. So we have specific housing for our young people to apply for, where they can be included in like a safe space, and they can kind of work on their goals from there. Our drop-in center is open 24/7 with some slight breaks within the day. So a young person can be provided like safe space 24 hours a day once they've completed an intake. We serve 2 meals a day, and also we have clothing, a clothing closet, so a young person can potentially get new clothing. And also we have an educational program. So a young person can pretty much, once they've arrived at AFC, begin to get services and find housing and kind of like get back on track. We also have multiple groups per day. So a young person can kind of figure out what their goals are and then work from there. So that's just like a little bit about what we do at AFC. The next slide I'm going to kind of go into, thank you.
Down the little.
Oh, I see.
It's a little hard to, it might be easier with the arrows actually. If you wanna.
So the next slide we have, we're just going to talk a little bit about like our youth experiencing family rejection and how that can affect them. So here we have LGBT plus youth and homelessness and some statistics. So this research on family conflict indicates that conflict over sexual orientation or gender identity can provide like a significant factor leading to homelessness and the need for out-of-home care. Studies indicate that once homeless, LGBT youth are at higher risk for victimization and suffer higher incidence of mental health problems, unsafe sexual behaviors than straight homeless youth. They experience an average of 7.4 more acts of sexual violence toward them than heterosexual peers. Joanna, is there anything you wanted to add for that slide?
No, not for this one.
Okay.
Did that work? Let me see if I can help you.
Thank you. So rejection consumption is a source of anticipation of ongoing rejection and pain. So I just want to say on that slide that a lot of our youth are being rejected from their families and their support systems, so sometimes sex work or survival sex may be the only option that they have. This slide kind of just goes in to the statistics of non-LGBT youth versus LGBT youth, LGBTQ plus youth. So these stats are taken from the Voices of Youth Count, a national research on homeless youth from Chaplain Hall, released in 2018. It just gives a picture of the differences between the experiences of youth that identify as LGBTQ plus and non-LGBT youth. So if we look more closely, we can see that LGBT youth experience more discrimination from their families, are exchanging sex for basic needs, may be forced to have sex, are being physically harmed by others, are harming themselves, are exposed to discrimination from and stigma from within their family. And here we have some statistics on LGBT plus youth and trauma. So we can see these are from our 2017 intake statistics. So this is once the youth is first coming in the door and kind of like doing an intake, so we're finding out what services they may need. And so we do include questions on trauma. So if you look at these are, I would say, pretty high. So we believe on intake of first meeting a youth that these are underreported. So child abuse is 63%, childhood sexual abuse is 45%, witnessing DV as a child is 64%, and so on. Impacts of trauma. So here we have trauma impacting all aspects of our youth lives. As we saw before, the statistics of trauma before, this can affect their self-concept, their relationship with others in their community and environments, and this often results in reoccurring feelings of shame, guilt, rage, isolation, and disconnection. Joanna, did you want to add?
I will say that, just like Jonathan mentioned, a lot of the statistics for the transgender youth are oftentimes drastically underdocumented. For example, the transgender youth, even in my program, when it comes to surveys, etc., for the agency, they'll just put male or female. And a lot of the time it's like, who am I disclosing that I'm transgender to, etc. The youth in the transgender housing program come with a lot of trauma. Oftentimes they're coming from different countries. They're coming with very long histories in the sex work industry. A lot of our youth are being forced into sex work, etc. And the transgender housing program is the first program to have therapy come to the program itself, and that has been extremely beneficial for the mental health of our youth.
Thank you. So we want to just give a definition of underground street economy. So it's engaging in illegal behaviors as a means to access resources needed to survive. So this can be money or a place to stay. Clients often don't have other ways of accessing resources at this point. It's important that for our services that we create an environment where we're using harm reduction and discussing our youth involvement in a street economy, I think in a way that we're not saying, no, you can't do this, but we're trying to find constructive ways that alternatives to this. Joanna, you want to say anything on that?
Another thing that we see a lot within the Forney Center is a lot of young people using illegal hormones, black market hormones, purchasing from people in the street, and then, that's when we connect them to the HOP program at Callan Lord or IFH, who comes to our drop-in center to meet with our young people. But it's actually a lot more common. People think.
So here we have influencers of initiation into street economy. So this is kind of just a look at how our young people may be getting initiated into survival sex or sex work. So it can be a social control or bonds. So people that they're meeting can coerce them. Barriers to formal economy. So experiencing homelessness, educational deficits, mental health problems, having a record, being incarcerated, and also the stigma of being LGBTQ+. It can also provide tangible social and emotional benefits, so tangibles being like money or a place to stay, or an emotional connection of being, I think, a place where they fit in or a place that they can make money. We can also look at just our young people's severe economic need. So, I mean, we live in a very expensive city, so people do need money to survive. And also just active recruitment by other youth or folks that they're meeting out in the street. So these acts to obtain resources can obviously be survival sex or sex work, or selling illegal drugs or prescription drugs, or theft. So a little bit about sex work and survival sex. Okay, go back. So LGBTQ+ youth are 7 times more likely to exchange sex for money or shelter, and about 1/4 of our clients report exchanging sex during intake. So, this is the first time that we're meeting them at intake, so I think those are also underreported. Johanna, you want to say a little something on that one?
The next slide is mine, right?
Yeah.
So, the Transgender Housing Program is actually a very successful program, and it was created because even within our LGBT agency, our transgender youth were struggling to graduate the programs, and through speaking with our youth, finding out why they were being discharged from the programs, it was a lot of violence, etc., because of their gender identity, even in an LGBT agency. The Transgender Housing Program is a program that really meets the clients where they're at. When I first received this program, I was told that the curfews were 10 p.m. And, when I have a program that houses the majority of the youth that are disclosing that they're engaging in survival sex work, having a curfew that's 10 p.m. is not reasonable. And, I'm very blessed to work with an agency that really listens to the voices of their employees and everything. And even myself, as somebody that has at one point had to be a teenager surviving in the streets, surviving through illegal sex work, etc. We were able to work these things, and now we're seeing our transgender women graduating the program, gaining employment, and now we're getting internships that are specific for our transgender youth, preparing them for independence. But in order to do that, you have to meet them where they're at.
Thank you.
So shifting gears a little bit, I am also from Callan-Lord Community Health Center, like Jonathan, and I'm the director of the Health Outreach to Teens program. So our services really complement what Forney Center provides. We primarily focus on the health and mental health needs of LGBTQ young adults aged 13 to 24 in New York City. One of the real assets to our services is that we're able to provide services to insured and uninsured youth regardless of ability to pay. So some of the services we do provide are primary care, trans care and hormone therapy, HIV care and HIV and STI testing, PrEP and PEP care, women's health services, as well as therapy and psychiatric care, care coordination services, insurance enrollment, and support groups and other supportive services. In our clinic, we also have an on-site pharmacy, which really eliminates some barriers to getting medication in a safe way. Part of our program is also our mobile health program.
Not working.
So, early on in creating our program, we realized that, Young people are not always going to come to a clinic for various reasons like discrimination in the healthcare system, lack of resources to even get to a clinic, and also fear of being outed because we are an LGBTQ space. So what we have is a fully equipped medical vehicle which provides services throughout New York City, which really brings healthcare services to young people where they're at. So the services we do provide are primarily low-threshold health services, so sexual health screenings, and then more urgent care and first aid. We are also able to provide things like vaccinations and physicals for employment and education, and then some supportive services, with the goal of really linking young people to the clinic, ideally, and also linking them to other services like the Forney Center. So the way we provide our services is really trying to understand where young people are and meeting them where they're at. So we partner with different agencies, including different LGBT or non-LGBT homeless youth drop-in centers and emergency shelters, as well as other spaces where we know young people congregate. So it's a bit of a mix of partner organizations, especially homeless serving youth services, and then also parks and outdoor spaces where we know young people congregate. And we know having that balance of consistent sites really helps engage young people, create trust, and then also having partner agencies refer to us sort of enhances that reason for young people to want to come to us. So one of the reasons we really focus on mobile health is, as I said, we know that young people are not always likely to come in for services for multiple reasons and multiple barriers that they face. So we know that providing services near places where they are at, including common strolls, bars, late night events, we're very involved in the house ballroom community, is really the best way to serve them and also give them an understanding of, being in charge of their own health, but also understanding that we are part of the community and we're a safe place for them. So we literally meet them where they're at, and we also tailor hours to where and when they are out and most need support. Our presence on the streets is also, it serves a dual role of providing these services like sexual health services and urgent care services, but also having a safe space for young people. So we find that very often when we're out at, say, 2 in the morning, young people can come on the van, have a hot cup of tea, and also have somewhere that they feel safe where they can hang out because they are targeted on the streets. I think some of the most important things that we really focus on, like Joanna and Tracy said, is really having a harm reduction approach, but also the role of cultural humility, knowing that young people should not be forced to, access services and don't always want to access services. There's also the role of discretion, knowing that if young people are accessing our services and are seen, then that might also jeopardize their safety and also their ability to make money. And so we want to be cautious about when we're approaching young people on the street and talking about our services. Some of the big assumptions that we try to really avoid is assuming sexual orientation because of sexual behaviors and practices. Young people who are engaging in sex work may not identify as LGBTQ or whatever it is that they're practicing on the streets to make money. And the same thing goes for gender identity. They may present differently in terms of who their clientele are versus who they are themselves and how they identify. A big other assumption to avoid is assuming the risk of HIV and STIs because of their engagement in sex work. So we know young people may engage in a range of activities, and I think one of the things we really focus on is we do an assessment understanding that the types of sexual behaviors and practices they engage in through work might be different from their personal lives. And so trying to really do a full assessment to know the gamut of what they're engaging in is really important. We know anecdotally in New York, a lot of young people are really aware of PrEP and are on PrEP, which is connected to their engagement in sex work. So it's also important to know that young people are staying safe and share information and resources with each other. So some of the tools for just engaging with young people when they disclose that they have engaged in sex work or they are currently engaged in sex work. I think Tracy mentioned a lot about different questions on intakes, and I think it's really important to know how to frame those questions and how to define sex work, because a lot of young people might be exchanging resources or whatever material goods, but may not they themselves identify as sex workers, and so it's really important not to label them themselves. We do a lot of safety planning with young people because we really focus on harm reduction, so that might be really simple tips like having a buddy when you're engaging in sex work, having a working phone so that you can contact someone if you're in trouble. We tell people to take pictures of license plates if they're entering a car, know their location, and so just really providing them with tools to stay safe because they're in charge of their lives. Knowing your rights is really important, and giving legal support to young people who engage in sex work. And we'll talk a little bit more about the nuances of legal systems and their interactions with them. And again, I think Joanna really focused on housing and shelter and the restrictions that may be caused by that, that then lead to young people being on the streets. But working with programs like Forney Center, where curfews can be a little bit flexible in terms of understanding what the need is for young people, is really important. When we deal with other programs, though, in terms of DHS shelters, we do really try to be realistic with young people and try to figure out ways where they can tailor their working hours to still being able to secure housing or shelter. In terms of behavioral health, we really focus on feelings of empowerment and control over their bodies. And sometimes this also means affirming their gender identity. A lot of young people who are trans and gender non-binary identified do report that sex work can sometimes feel like a very empowering space where they can be who they identify as. And so exploring that and figuring out other ways that they can also feel affirmed is really important. And then we also just want young people to be able to understand that they have power and control in these situations, and that they should be able to assess that with clients so that they know when something isn't consensual and when they do need to really assert boundaries. Finally, for medical providers, as I said, we really want to focus on risk, but in a sex-positive way. So be open to asking all questions about sexual behaviors, educating young people about PrEP and PEP and access to those things, but also knowing that not every young person is going to want those things just because they're engaged in sex work. We also do focus a lot on the role of substance use in sex work. It's one of the things that we also really use a harm reduction approach around. So we also give tips to young people in terms of knowing your limits to use. And if you are using while you're engaging in sex work, to know what your limit is and being able to say no to someone who's offering you substances. In New York City, we're seeing a huge rise in crystal meth use, specifically in young people who are engaging in sex work. So in terms of legal systems, it's very, very important to equip staff and patients with up-to-date legal information that really disproportionately target LGBTQ and feminine-presenting communities, youth, and communities experiencing homelessness, people of color, and people engaging in sex work. In terms of sex work and criminalization, it really varies by state to state, but it's something that you should all be aware of in doing this work. In some states, sex work is under sex trafficking laws. At the federal level, it is actually included in sex trafficking laws, so it's important to know that and know what a young person could be charged with if they are caught. Minors' access to health services, so I spoke about PEP and PrEP and sexual health services, but this also varies in terms of state to state. And so knowing what young people are able to access without consent from guardians is very, very important. And then also knowing what access to care looks like for undocumented communities. In some states, undocumented folks are able to access emergency rooms or federally qualified health centers like us, and so it's really important to know that so that you're able to provide them with the resources they need. In New York City, 9 out of 10 people arrested for sex work are immigrants, and this can lead to detention and deportation. As Jonathan had mentioned, a lot of the people we're talking about are also parents, and so it's important to know what that looks like in terms of child custody laws. You know, in New York City, we have quality of life laws, and many, many cities have this in terms of loitering and discriminatory laws. And we know that these laws are really targeting people of color and poor people, and so it's important to know what those laws are in your state. In New York City, 94 people who are arrested for loitering with the purpose of prostitution, however that is defined, were Black women. So finally, just to sort of go over the differences between sex work and sex trafficking. Sex trafficking we define as involving threat or use of force, abduction, deception, or other forms of coercion for the purpose of exploitation. I think often we have this idea of it being young people or people from different countries and coming into the state, but that's not actually the full definition. It can be any kind of threat or use of force in a sexual activity. Sex work, however, is consensual. It's a consensual transaction in exchange for goods or materials, and so there is a real difference in terms of defining those things. We also want to really focus on the fact that those who are engaging in sex work are not necessarily victims, right? And they have self-determination and agency that should be respected. We still acknowledge, like Tracy said, that there are reasons why they engage and are initiated into sex work, and that might be from some form of, social pressure, but also because there's a lack of resources and discrimination through financial opportunities and employment, right, that really impacts their ability to get other jobs. In terms of legal implications for youth engaging in sex work, this is where the sex trafficking definitions get a little bit tricky. A lot of human rights advocates really define sex work through age of consent laws, which also vary from state to state. And that means that minors who are engaging in sex work, if they are charged with something, it is considered a sex trafficking issue. And so this can also be tricky when you're working with youth who are under, say, 17 years old, but are engaging in sex work with people, with their friends who are 21 years old or 22 years old, because that puts their older friends at risk for sex trafficking. And then finally, just in terms of a big picture advocacy, some of the things that we really want to focus on is in New York State specifically, we're really pushing for the decriminalization of sex work. And I just want to say the difference between decriminalization and legalization. So decriminalization would really remove all penalties that apply to someone engaging in sex work. So that's criminal and administrative penalties, and what that means is really people who are engaging in sex work would be protected under labor law. It means that it would be considered an actual means of employment, and so would have some level of workplace protection in terms of health and safety, child custody laws, and also social security protections. Legalization is really the regularization of sex work, which means that it's sort of based on the health of clients, or it can be sort of regulated through taxes, or what they call public morality, which is how a lot of Scandinavian countries define this. So one thing that we've seen in the past is really including things like mandatory HIV testing. So we really want to push for decriminalization in this.
And Elena, do you want to give instructions?
Yes, thank you. Wonderful. Thank you to all of our presenters. That was a wonderful presentation. So thank you, Jonathan, Joanna, Aruna, and Tracy. One of the things I just wanted to mention is that after hearing our great presenters speak, some of the learning objectives that we hope that you, the audience, can take away and walk away with is to be able to provide introduction to the relationship between sex work and homelessness among diverse feminine presenting communities. Second, we hope that you walk away with are able to present service delivery efforts for feminine presenting clients engaging in sex work, specifically with New York City youth. And lastly, be able to discuss nuances, challenges, and successes of providing care to special populations at the intersections of oppression. So those were the learning objectives we hope everyone was able to kind of get from our wonderful presentation. And so at this point, we are going to go and begin our Q&A portion of the webinar. If you have not yet done so, please feel free to enter any questions you might have for the presenters in the chat box. Also, as we go through questions, keep in mind that the CMA claim code is now available and will only be available during this session. So please make note of the code if you plan to claim CMEs. So for our presenters, we did have a few questions come in that I'd like to start with, and I see more coming in, so that's great. So we'll open it up to the panel. So the first question we have is, why is emotional gain included in the definition of sex work? This was interesting and unexpected. So this is one of the earlier slides.
Yes, so I think that was one of the first slides where we identified what sex work is. See if I can catch it really quickly. I would say that as the expanding definition of sex work to be included, to be inclusive of more ways and reasons folks engage in sex work, emotional gain is sort of a non-material good. Tracy mentioned it briefly as like maybe a place to fit in, you know, or gain public attention as is online and things of that sort.
Yeah. In terms of working with the youth, I think Tracy said, yeah, fitting in, but then also being affirmed in terms of their gender identity and sexual orientation. This is sometimes a place where young people feel like this is one of the only spaces where they can actually feel affirmed. And so, I mean, that's something really worth exploring when you're working with someone. But sometimes that in itself is the reason and what they get. You know, one of the things that we talk with young people about is really setting prices and being clear about what they are exchanging. But we have found that a lot of young people who are engaging in sex work actually don't receive any monetary compensation for their activities. I mean, we know that housing is a big one, sometimes substances, but sometimes it is just this feeling of exploring their gender in a place that is completely separate from their lives. Great. Well, thank you. They keep coming in, so I'm going to try and keep up, and hopefully we can. We have a good amount of time. So the next question, someone was just asking for the acronym of IPV, so I did respond to that, but others who might be interested are IPV stands for Intimate Partner Violence. We got many questions about PowerPoint, so that has been added to the files on the screen, so feel free to download that. And the next question was, with the drop-in resource, could you elaborate a little bit more?
Yeah, so I'm not sure specifically which drop-in resources, but at the drop-in, they can meet with a case manager, so that's like their point person where they can kind of like get a game plan for, I guess, like the next goals that they want to reach, or like becoming more safe. We serve meals, they can get clothing, supplies, meet for groups, check in with a psych therapist, get medical attention, as well as, I think more importantly, it's a safe space.
Great. Thank you. Another question that came in, there were some statistics shared on an earlier slide previously. Can you share where those were from? I'm assuming they're from New York.
Which statistics? I'm not sure. These were from the Homeless Assessment Report to Congress, 2018. Those are the same. Those were Health of Homeless Adults in NYC, Department of Homeless Services in 2005. And the Alice Forney slide, this, can you see what's that?
High and Serve 2017.
Yeah, and that came from
2017 intakes.
2017 intakes from the agency, as well as this one.
Great, thank you. I think those were exactly the ones they were asking about. Another one that came in is, can you give some examples of harm reduction techniques in sex work with people experiencing homelessness?
Yeah, so I think some of the techniques we have are really preparing young people for what, so I guess there's two parts to it. One is that we often see young people who are thinking about sex work as an option, often when they know that they are probably going to face family rejection and are looking for other means of income or surviving on the streets. We talk to them a lot about what that would look like. And so that's one process in terms of preparing them for the different types of sex work they can engage in, what safety looks like to them, what the sexual risks are, and, you know, in terms of STIs and HIV, but then also emotionally, what would that look like? So one part is really sort of preparation. And then the other is young people who are engaging in sex work. I think what we do is just really logistical planning. So what are your hours going to be? Where are you going to be? Who do you know? What are your resources? Do you know how to access an emergency room? Do you know how to access the police? And what is that going to look like? Is that even going to be supportive to you? Do you know where you're going to go afterwards? One of the big things we like to do is really concrete, like just have a phone on you, have a buddy, know how much money you have, know when you're going to be paid. And so that's kind of the harm reduction part, just acknowledging that young people are going to engage in sex work, and so we should plan on doing it in the most safe way as possible.
Joanna?
We're very big on just avoiding shaming the young person, just letting them know that they're in survival mode right now. That it is a no judgment zone. Specifically in our program, our clients voice finding a benefit in having so many of the staff be a part of their community. And we also have client interns that serve as that help us with the communication between staff and residents. And sometimes my client liaison approaches me and it's like the residents they don't want to go to the drop-in center for condoms, so we bring the condoms to them. The residents feel like there should be art therapy on site. That was actually brought to my attention by one of the client liaisons, and that's how we got art therapy in the houses itself.
Mm-hmm. And those are peers, or?
Peers, yeah. One of my current client liaisons is actually a graduate from the Transgender Housing program, so he's come back as an intern, really helping us out.
Great, thank you guys. That was wonderful. They just keep coming in, so I'm trying to keep up. So those on the call, if we, again, don't get to your answers, we will share them with the group and we will get those to you in written response. Another question that came in, this was for Aruna, but really is open to the whole panel. But you mentioned a lot of your youth were aware of or on PrEP. Can you talk a little bit about how that came to be and any advice to reduce as many barriers as possible?
Sure. So I think it's twofold. One is at the city and state level. I think there's been a lot of education, a lot of public health campaigns to really spread the word about PEP and PrEP, specifically PrEP, I would say. And so, I mean, in New York City, I think we're pretty lucky in that way. And then the second part of it is really internally. we use a number of different ways to really educate young people about PrEP. One of the things we have is, if you go onto our YouTube channel, we have a whole series of PrEP videos. It's PrEP 101, and they're really fun, they're accessible. Young people really enjoy them, and they get a lot of information across, but in a really, really nice youth-friendly way. And so we have them playing in all of our waiting rooms. We have it on the mobile unit, and then we also use it as a tool for education. And so it's just one way of really getting young people to know what PrEP is. And we've actually found that young people actually say that, I'm interested in PrEP because I watched that video. And then we also just we make sure that at the case management level, behavioral health level, and medical provider, they're always getting information about PrEP and PEP. And I think the information is, there's a lot of different things that we really want young people to know. The first is, basic definitions of what they are and figuring out where they stand on it in terms of risk. And we have those conversations over and over again because young people's understanding of risk and their own behaviors shift all the time. And so we know that, if we talk to someone one day, in 3 months that might change, right? And so we want to keep talking about PrEP and PEP. The other thing is really in terms of access. So, they can access those things with us, but it's also important to give them all the options, especially for PEP. Just because, the hours might not actually coincide with when we're open, and we want them to know that. And then the other part of just educating young people is knowing their legal rights in terms of being able to access it, knowing, what insurance coverage looks like. We're pretty lucky in that New York State has something that really covers most of the costs, and so does Gilead, and so we're able to provide those services without insurance barriers. And now, as of last May, we're able to provide those services without guardian consent. So I think, again, really based on states, like the legal part really shifts.
And just to add, the New York City Department of Health and Mental Hygiene has really been a close partner with a lot of this on the PrEP initiatives. They really have made it a point to get the word out. They have a whole campaign called Play Sure that you can see on their website, and it's posted in subways, it's posted on bus stops. They have it on public access as commercials, as well as taking our video and working with us, our PrEP 101 video, and playing it in their waiting rooms at their STD clinics around the city in all of the boroughs.
We also send it to schools when they ask for more information, so that is another way of really getting young people to know about this.
Great. Thank you. I see we have 3 minutes left. I would love to get 2 more in. There's a lot more that need to be answered, so we will get those to you. But I thought this one was really interesting. Hi, I am a new peer navigator at a day shelter that serves women and transgender people experiencing homelessness. As a cisgender male, what do you think is the best approach for helping a trans individual feel comfortable and safe coming to speak with me, potentially about some of the traumas you have covered in this webinar?
That's a great question.
Oftentimes when I'm meeting the youth for the first time, the first question I ask is, what are your pronouns? And with that, there's already a level of comfort, that we're acknowledging that, we're not making an assumption just by looking at them. And, even in my program, we have a lot of allies that work for the program. Not everybody in the program is transgender identified. But, everybody comes with an open mind and just listens to the young people, and is very cautious about pronouns. When mistakes happen, we don't make a big deal out of it. And, we apologize to the young people, and then we just continue working with them. And, encouraging them to be themselves, and, supporting them where they're going through a lot of discrimination wherever they go.
Yeah, we also have on our website a Pronouns Matter video on the YouTube channel. If you check out the YouTube channel that I believe is going to get sent out, or thank you, Hannah, just sent it out. And that basically shows how we deal with pronouns and creating safe spaces for folks who may present one way, but making clear to them that we are not going to assume just because they're masculine presenting or feminine presenting that we know their gender, right? And so we allow folks to change, not to change, but to let us know. We have stickers at the front desk. We constantly ask, if you notice, we started by introducing ourselves always with pronouns, understanding that pronouns can change from day to day. And so just because someone told you their pronoun once doesn't necessarily mean that that's their pronoun forever. And so that's really important in sort of creating those systems to allow open dialogue and comfort in the space.
Great, awesome. And I wanted to get one more in, and I don't think I'm going to get a chance to do it, another question, but like I said, we will respond to them and send out those responses. But so I want to be mindful of time, so we're going to go ahead and just kind of end. So thank you for presenting today. We learned a lot. I definitely have gained some more knowledge as well, so thank you. To our attendees, thank you for joining today's webinar. A link of the archived webinar will be available on our website, www.nhchc.org. At the conclusion of our spring virtual training, which will be the end of the month, please copy and follow the instructions again to claim your CME credit for this session. The claim code has been provided and will only be available now, and credit must be claimed within 3 days. So make sure you write that down. I see it on the screen right now. An evaluation of today's presentation should automatically appear in your browser when the webinar closes. If it does not appear, please copy and paste the link provided on the closing page to access the evaluation. Thank you, and we appreciate your time today. Please make sure that you download the resources, the final slides, as well as make a note of the YouTube channel. Thank you again, and the webinar is now